Hi, David Sweeney here. This video is about winging of the scapula, and that means the muscles that support the shoulder blade have become weakened through poor posture, and that means that the shoulder joint itself is unable to move correctly, and it often drives a lot of tension and stress into the upper trapezius muscle, therefore affecting the neck and causing lots of trouble, chronic problems that don't go away for many years. So what we're going to be looking at is 4 stretching exercises and then 5 strengthening exercises for this condition. So let's jump into it. So the first stretch will be for the upper trapezius and the levator scapula muscle. So I'm going to hold down onto the seat I'm sitting on, turn the head to 45 degrees, lean away a little bit to get some tension on that, and then just with a light bit of pressure, hold this for 1 or 2 minutes, and then we're going to do the opposite side. So then the next muscle we need to look at is something called the subscapularis, and it's actually a rotator cuff muscle. It's in underneath here. It causes internal rotation of the shoulder. So if I pop the hand up like this, so we're at about 90 degrees to the shoulder and 90 degrees to the humerus. And what I'm going to do is wrap this arm in underneath like so, and then I'm going to pull it to the side like that. Okay, so a slightly easier way to improve that muscle is to grab a broomstick like this, put it in about the midpoint, and you can see I'm holding here with this hand. I'm just going to leverage that up and create this external shoulder rotation, and that will stretch that subscapularis. Okay, so the next muscle group will be the Latissimus Dorsi muscle right through here, and it actually attaches to the humerus about here and wraps all the way back down into the thoracic spine and even as far as the lumbar spine, and it causes a roundiness of the shoulder when it's tight. So imagine here I have a door frame that I can hold. Obviously I don't, but you can imagine. So I have a door frame and I'm going to hold it. I'm going to hold on to the door frame, and then I'm going to put this left hip back, and I'm going to be able to rotate like that. If I can keep this arm in line with my spine, so I might have to come up a little bit higher and then rotate. And that is a great Latissimus Dorsi stretch. Again, holding for about 1 minute or so. Okay, so finally let's move on to chest stretching. And again, we're going to be at a door frame or a window frame. What we can do is simply pop the arm, again in this higher position at about 135 degrees, lock it in position, and then move the body away from it, allowing these lower fibers of the chest to stretch. Now at 90 degrees, same thing, spending about 1 minute in each position, and then right down here at about 45 degrees and turning the chest away. Okay, so I'm going to show you pretty much the most important muscle for scapular stability, which is called the Serratus Anterior, and we're going to do a kind of a funny looking push-up. It's called a push-up plus to try to activate this muscle. So we want our hands in a diamond position because that's going to really take care of the position of this muscle, and it's going to be slightly above the head. So we try that now, like this, and it's not a push-up, so there's no elbow bending. So we put the shoulders into a retracted position, which is this, and then we push up all the way up into protraction. That's the muscle working right there. We relax, push through, relax, push through. Now, if you're struggling, just go onto the knees, and that will be much easier. As you advance, what you want to do is pop an exercise band down. So we simply wrap that over the shoulders like that, bring it down into position here, and we'll get some resistance from the exercise band. And this is a really important exercise, so you'll be working hard on this one. 20 repetitions, do that 3 times. If it's too easy, add the exercise band. If the blue color is too easy, go up a few levels, add more resistance. Okay, so the next exercise will be the middle trapezius and also the rhomboid muscle. So what we're going to do is take that exercise band, and we're going to pull it straight out to the side like that. We're going to squeeze those shoulders hard and tight at the end. Pull, and we can actually resist this movement pulling back in as well, doing them nice and slow and controlled. Again, about 3 sets of 20, and this should feel like a challenge. If it's not, you can create more tension with a different band. Now for the lower trapezius, we just stand on the exercise band and then we're going to do these Ys like this and back down. So Y position, back down, Y position, squeezing the shoulders, back down. Or you could stoop forwards like this, contract the core, raise up. If that's too difficult with dumbbells, you can just do it with your hands. Squeeze the shoulders, back down, squeeze the shoulders, back down. In fact, that's a fantastic exercise, even standing upright. Squeeze, back down, squeeze the shoulders, back down, even if you wanted to warm up before adding the banded exercise. Okay, so moving on to the fourth exercise, this is going to be external rotation of the shoulder. And do you remember in the start we were working on the flexibility of the shoulder so that we get out of a roundedness, which is internal rotation, so that things are a bit more neutral. Well, this exercise, external rotation this way, can help really activate that and encourage the shoulder to stay in that position. It's also fantastic for the scapula to become stable. Now, I would recommend you tie this onto a door. So imagine this is tied onto a door, maybe a bed post or just something nice and heavy and sturdy. And then we can stand here and do these external rotation movements. 3 sets of 20, something like that. Okay, so we're going to work on the rhomboid. So we pop the exercise band around the feet like this, and we're going to be squeezing the scapula, the shoulder blades together. We're pinching them together at the back. So don't get tempted to just pull like this. That's kind of leading to the bicep working hard and taking over the action of the shoulder. So if you've got a really weak shoulder, what you're really going to need to do is focus on just squeezing those blades together, because if the muscle's been weak for many, many years, this is actually going to be surprisingly difficult to actually have the scapula retract and squeeze together like so. Now, when you get a bit more advanced, we'll do the bent over row with the dumbbell, and I'll show you that now. Okay, so now we're going to use a heavier weight, obviously, than the exercise band to train the rhomboids, and also you'll hit the middle trapezius a little bit here as well. So what we want to do is get into this bent over row position, and we're going to grasp the kettlebell like this, and we want to focus on moving the scapula backwards towards the midline, so towards the spine as much as possible. And the reason why I don't tell you to do this is because it's very easy to use momentum like this and work out your bicep rather than slowly and in a controlled fashion strengthening the musculature of the middle back. And again, about 3 sets of 20 here. Okay, so I hope you enjoyed the video. One more thing about the stretching. So sometimes you'll find that certain stretch positions don't really impact you that much, or the muscle isn't that tight. So what you need to do is just use some common sense and spend less time on areas that don't need as much work. But definitely the strengthening side of things, I want you to pay closer attention to that. So any questions, pop them in the comments there, please, and talk to you on the next one. Thank you.